in the UK, even as they begin the first COVID immunizations with a shot from the Pfizer vaccine. The UK plans to test it in combination with another vaccine from AstraZeneca. Studies aimed at determining whether using two jabs together can actually enhance immunity are planned for next year, according to the UK Vaccine Taskforce. Well, to talk more about all this and also how the vaccination has begun, we're now joined by Professor Ravindra Gupta, Professor of Microbiology, University of Cambridge, and someone who is featured this year in Time's 100 list of 2020. Thank you so much for being with us, Doctor, again. Well, first and foremost, of course, it's a remarkable feat, a big moment for the UK. The first batch of vaccines are being administered, but it's still a long way to go before the country is safe.
Yes, I mean, it's an incredible feat of medical science, and to go from a new pathogen to identification to developing a vaccine and proving it's in generating immune responses in humans to being administered in humans after safety studies have been done as well. So that's pretty remarkable in such a short space of time.
And what are the other challenges you foresee? Logistics is in transporting the vaccine, especially this one is one of the challenges. Also ensuring that people return for their second dose, because that's very important as well.
That's right. So because it's a two-dose regimen, it is important, essential for people to remember to get the second dose if they are to obtain the full benefit of protection from this with this vaccine.
And now good news coming on the Oxford vaccine front as well. The Lancet has just published that it is safe, but the efficacy, what are your views on that?
That's right. The Oxford vaccine appears to be safe. It appears to be immunogenic in terms of it's generating the right responses. We're a bit unsure about how efficacious it will be, but I think that if enough people are having the vaccine, we will have enough broad protection in the community as a result. So I think that it's all very good news to have at least two different vaccines that we're going to be using. And of course, there's a mix and match idea coming up as well.
Right. In fact, I wanted to ask you about that mix and match idea, these combination trials that are being planned in the UK in which two vaccines are going to be used. If you could tell us a bit about that.
Well, I think this comes from the fact that the Oxford vaccine was not as efficacious as expected in the full dose arm of the study, but in the arm of the study with the reduced dose, which was actually given by mistake, there seemed to be higher protection levels. And I think that what this produces is a kind of hypothesis or a thinking that maybe a combination of two different vaccines, one after the other, is going to broaden and strengthen the immune response. Again, it's an idea, and it should be safe because each individual vaccine is safe. So I think it's a reasonable idea to try and combine two different approaches. Without having to make a whole new vaccine, as it were. So it's a kind of easy win, potentially.
Right. If for our viewers, if you could just explain that a bit further. So using two different vaccines with different levels of efficacy to create a stronger immunity, that's what we're talking about?
Yes. I mean, we don't know how long this protection will last. You know, even companies claiming 95% protection. I mean, this is a potentially short-term protection. So we don't know what the optimal regimen, what the optimal vaccine is for longer-term protection from SARS-CoV-2. So I think that exploring different avenues and combinations is a reasonable approach.
And, you know, while we're talking about how it's a remarkable achievement in 10 months, we have a vaccine in place. There are many people who feel that's a problem, 10 months and already there's a vaccine. So what about this issue of vaccine hesitancy?
Yes, I think people can be worried about anything, but I guess that we have been vaccinated, we all have been vaccinated many times, and the vast majority of all the vaccines have been safe. So I'm not sure, I'm not a believer in suddenly thinking, oh, this vaccine may be dangerous for some unknown reason. I think the history of vaccination shows us that in general, they are very well tolerated. And the ones that we would worry about more is when you have a virus that's been inactivated that potentially could still cause some some disease, but this is not a whole virus vaccine.
Right. Of course, you wouldn't be worried about it, but don't you feel this is an issue that needs to be addressed, this vaccine hesitancy? It's important, for authorities, for the scientific community to come together to remove these doubts?
So vaccine hesitancy is potentially a problem. I think that social media has probably made this a bigger problem than it would be otherwise by introducing doubts into people's minds. I think it's easier to spread negative information than positive information. So it is a thing. I think public messaging is important. I think high-profile people having the vaccine publicly is important, so that the public realize that actually people who are informed and who are in powerful positions are all coming to have the vaccine. I think that's important to see.
All right. Now, it's still a long way to go, even though the vaccinations have started in the UK, before the entire population is actually even protected, since the vaccinations have just begun.
There are a lot of infections happening. We need to reinforce the need for social distancing and the usual measures because the protection of vaccines is still not here. And one concern that I have and some others is that vaccines, if they're introduced slowly, will potentially apply some selection pressure on the virus to facilitate mutations that could compromise the efficacy of vaccines in the longer term. So I think we need to get the vaccines out quickly and rapidly and effectively so that we can reduce transmission and therefore prevent emergence of resistance and mutations.
Or if you could just explain that a bit further, this worry that you're voicing about mutations in the virus in case the vaccination process is too slow?
Yes, I mean, a virus is essentially something that responds to the pressure applied to it. And we have seen in a number of cases in the UK mutations in a very critical part of the virus, which potentially allows it to be less sensitive to antibodies, for example. And these mutations do arise and, of course, can be transmitted. So we need to limit the emergence and transmission of these mutants. And the best way to do this is to stop transmission either by social distancing and public measures and mask wearing, or with a vaccine or a combination of both. And that's why we really need to reinforce the public health measures whilst we implement the vaccine so that we do not inadvertently generate a situation where some people are vaccinated, some people aren't, and the virus is able to acquire mutations and pass from one person to another. So I think people need to be aware that this is a possibility and that we need to take this vaccination program seriously and do it properly.
All right, Professor Ravindra Gupta, thank you so much for speaking to us here at NDTV.